So if you're only missing one tooth, why a dental implant over a bridge?
So Randy, the bridges are okay. We've been using them for a very long time, but they're a bit old-fashioned in my practice. When you do a bridge, you have to take two good teeth and shave them down, and in order to be able to put the bridge on. And the patients can't floss, and they can't clean in between them, which causes other problems like cavities in between the teeth.
Okay.
So now you have a three-tooth problem. Every time something happens to those two adjacent teeth, you may end up having to take that bridge off or do some additional work. But with an implant, you just focus on the site where a tooth is missing, and you put it in, and it becomes much like a natural tooth, where you can clean in between and maintain your implants. And the lifespan of a bridge sometimes is only 15 years, but the implants will stay with you for as long as you stay
It's like
around.
permanent.
Permanent.
So if your family member was missing just one tooth, right? Would you always give them an implant over a bridge?
Absolutely. I couldn't see a reason to give them a bridge when there's an option of an implant.